Hi, Dr. Shakib here from Core Pelvic Floor Therapy in Irvine, Orange County. Pelvic floor dysfunction treatment is the subject of this video. Is it just the kegels? Is it all these external devices? What is the actual treatment? So stay tuned. Okay, let's talk about core. Basically, more than core. I just jumped into the conclusion here, but let's talk about pelvic floor dysfunction treatment. And currently, the treatment essentially includes medication. It can include external devices that are inserted through your private parts. It may include surgery. It may include pelvic floor physical therapists, where they go inside of your pelvis through the vagina or the anus to access those muscles. It may include devices that they make claims, and then there are devices that actually work. In our clinic, which sets us apart from every other clinic that addresses pelvic floor dysfunction specifically, we have a machine called emsella chair, where you sit on the chair, nothing comes out, there's no vibration or anything like that, but you sit on the chair, and it's designed for incontinence by causing kegel exercises, muscle contractions that strengthen the pelvic floor muscles. So it's FDA approved for that, but kegel exercises are for all pelvic floor dysfunction cases. So the machine does actually 400 kegels a minute, more than one a second, over the course of the session, which is 28 minutes. By the time you're done with the 28 minutes, it's 11,200 kegel exercises, which I know is more than you would have done anyway. But should we stop there and call it it? And the answer is absolutely not. The floor is not free floating. It's not just suspended in the air. It's connected to your body parts. So its integrity is absolutely depending on its connections. So the treatment in our office specifically is not just the emsella chair with 400 kegels a minute. It has to do with movement of your body parts, specifically focusing on the lower body parts. So we're talking about anything from here down, which we consider core. This area is considered core in most of your eyes, and I'm here to tell you your core is not just this. Your core is here. The area between your abdominal diaphragm and the pelvic diaphragm, which is right above your pelvic floor, is compromised and heavily depending on your breathing. So the treatment in our office involves proper breathing. So the question is, what is proper breathing? It's not something we made up. Proper breathing is what we all did as babies, because we were programmed to breathe automatically like that. In our office, we do not. Our treatment for pelvic floor dysfunction does not include things we make up. We look at how we're designed by looking at babies and their movement and their behavior and movement to fix the dysfunction that is created more than likely without us intending it to happen. So the treatment of pelvic floor dysfunction in our office is very unique to your situation. And it's very unique because I don't know any other offices, and believe me, I've looked things up to see how different their treatments are, and they're not. So I'm going to make sure that I put all the resources available for you to check them out. You're more than welcome to send me any questions you may have. I have a podcast you should subscribe to so you better understand what you're missing. And more importantly, do know that there is hope. And if you think you can sit, and by the way, weaken your pelvic floor, and expect for the magic to take place, you're dreaming. Thanks for watching. Take care.